Welcome. I'm your host, Dee Dee Berg.
Well, hello there, everybody. Welcome to Wake Up to Life. My name's Dee Dee Berg. I'm your host. And today I have the very special honor of being with Dr. Emad Gerges. So Dr. Emad was a general surgeon for 25 years. He had it all. He eventually opened a cosmetic surgery clinic. He had a beautiful house and a clinic on a lake. And now, today, he finds himself in a different kind of paradise. So what we're going to talk about is why he left allopathic medicine and ventured into rejuvenative medicine. So welcome to the show.
Thank you, Dee Dee. What an honor to be here.
And Emad, we got to cheer. I mean, we are literally in paradise. So cheers. How did your journey go from being a surgeon in Canada, having it all, having this beautiful place, beautiful cars, you describe like walking down a pathway by the lake, to eventually giving all that up and then finding yourself in a different kind of paradise?
Yeah, you know, Dee Dee, I call myself a recovering doctor.
Okay, tell me about that.
Well, it all starts with medical school. The very first day of medical school, we're taught and programmed, I would argue, to think a certain way about health. And that is that we in allopathic medicine, organized medicine, are the only ones that have the authority to deal with health, any health issue. We are superior, and that gets in your head. And along with that, we're also told that anybody else that tries to come into our territory, whether it be naturopaths, osteopaths, regenerative medicine specialists, they're all inferior. And so that gets in your head. So when you get programmed like that from day one, you start to incorporate that into your entire psyche and your worldview. So for example, if a mother comes in and starts questioning the vaccine schedule and says, I heard that vaccines may cause autism, automatically our first reflex is, oh, this is one of those conspiracy theorists. She doesn't know the evidence. She doesn't know that vaccines are safe and effective. And all those things get in your head. And all that is fueled, of course, by the backdrop of big pharma financing everything from our medical education to medical journals to what media has to say about medicine and health. But you know, Dee Dee, that's part of the formula of medicine. And so that's the reward system that's built in to programming you. So you finish your residency, now you're ready to practice, and you go from literally from poverty to massive like cash flow, at least the gross cash. And the bank managers are coming to you, like practically begging you to get a loan, getting a mortgage, a house on the water. And you look at your colleagues and they all have the same thing, and you think, well, you know what? I did work hard for it. You start to justify it, and before you know it, you're living this lavish lifestyle, most of which is funded by credit. Like you've got a massive mortgage now, you got lines of credit. Usually most doctors with expensive cars, they have a lease on the car. You are literally hooked in, and you have no margin for error. So if you have a financial or personal catastrophe, which sadly I did, it all can come falling down. I had to really reassess life in general. Then this door opened.
So tell us about this door, because right now we are in lovely Puerto Vallarta, Mexico.
Yes.
We are on the beach, as you can see. And you now work at the Holistic Bio Spa, which is a regenerative medicine clinic. So tell us a little, first define for those people who are unaware of what regenerative medicine is. What is that?
Regenerative medicine, I would argue, is almost the opposite of allopathic medicine. So it doesn't use big pharma medications, which are toxic and usually unsafe and often ineffective. Regenerative medicine really focuses on the immune system, natural immunity. So what we do is we do not disturb natural immunity. So instead of competing and attacking the immune system with things like vaccines and chemotherapy, we really revere it. We feel like, okay, God designed this for a reason, and it's extremely effective, way more effective than any vaccine that we can give.
Right.
And so we protect the immune system, and when somebody has issues of, for example, toxicity or cancer, our interventions are boosting the immune system's efficiency, not competing with it. For example, use cancer treatment like methylene blue, ivermectin, fenbendazole, all those things, even natural killer cells, are meant to bolster the immune system and protect healthy cells and attack the nasty cells like cancer cells and attack the any antigen like whether it be mold or viruses or parasites. We attack the bad guys, if you will, and we protect and revere the good guys.
The minute I learned about plasmapheresis and the 10 pass, they actually have a way of filtering your blood. So, I mean, I was in. I think it took me about, 2 hours to decide? And I was like, okay, Emad, I'm coming. I'm coming.
And what an honor, like, to find that synergy like that, and the timing and the alignment was incredible.
You can filter parasites, viruses, bacterias, what else out of the blood? Toxins?
Toxins, for sure.
Spike protein?
Spike protein is a big one. We're getting a lot of referrals now as people discover that you can actually eliminate spike proteins with plasmapheresis and other treatments. These spike proteins go throughout the body. And so we're finding people that have had significant complications from spike proteins coming to us and getting the full detoxification treatment, the most pivotal of which is the plasmapheresis. We have a gentleman now that came from out west in Canada, and he's been sick for 2 years. He was a bodybuilder, and he came in when he was healthy. He was 295 pounds. He lost 100 pounds, Didi, right after the second dose. Like immediately after the second dose, he started losing weight, losing appetite, and having severe pain, like chest pain, arm pain, pain everywhere now. And he actually thought he was dying. His two girls, aged like 9 and 12, like asked, like his wife, like, "Is Daddy dying?" Like they just
100 pounds.
They're literally watching him. And this is a guy that was perfectly healthy before, and so he was suffering from severe spike protein toxicity. And I would argue that his life was threatened. The chest pain could have been myocarditis. With one plasmapheresis session, his pain dropped significantly, and so he's getting 2 more plasmapheresis sessions, and then we'll do a follow-up spike protein count.
Right. You and Dr. Zoli recommended that I get a 10 pass, where you take the blood out and then you ozonate it, and ozone is O3,
correct?
Which is like I like to say oxygen on steroids.
Yeah, it is.
So nothing can live in a highly oxygenated environment.
Both plasmapheresis and we call it hyperbaric ozone because it's delivered under pressure. They both help with toxicity. We use even like ozone for cancer patients because what it does, like a cancer cell, bacteria, parasites, most of the antigens can't survive in a high oxygen state. That's why ozone and hyperbaric oxygen are extremely effective to combat toxicity. And so in the case of ozone, basically it's like 3 oxygen molecules. So it goes in, basically it compresses the oxygen into the tissues, plus the 3rd oxygen molecule binds to the antigen and fights it as well. So literally attacks the antigen. So it's one of our very effective tools. I never imagined, Didi, that I would have a day where I would just reflect and rethink everything that I was ever taught.
Right. You had to.
It's a lot of education.
To question.
Yeah, it's a lot of education.
Analyze. Because you analyze it right from the beginning, from the point of where they teach you to be superior.
100%.
Like those heathens that come in, they don't know anything about medicine. Yeah. You know, let's just dismiss them, right?
100%.
And finally, I mean, this is a little bit more of a familiar topic, but regenerative medicine and stem cells, in particular with injuries, right? So
absolutely.
Tell us how that works.
It's actually amazing. And again, something we're not taught in organized medicine, but regenerative medicine is literally like the medicine of the future practice today.
Yes.
As critically minded people do more research and dig into the evidence, they're finding that regenerative medicine is really evidence-based, strong evidence, not just like low level, like strong evidence that these things are effective. So stem cells are very unique. They're essentially like what we call undifferentiated cells. So they have no particular specialty when you receive them. And when you get them, like you get them either in the bloodstream or into areas of injury or inflammation, like back, shoulder, knees, and essentially they go in and they find areas of injury and inflammation through the release of enzymes from these tissues, and they gravitate to that area and they park there, and they start basically rebuilding and healing,
Right.
and transforming into that particular cell type. So if it's a muscle injury or pull, they literally transform into muscle cells, and they park there, they rebuild, they repair the injury, and they also stimulate your own cells. So even after they're done their work, your own cells are bolstered to do the healing.
Yeah.
And
It's like they rally your cells.
they really do, and they really like essentially like rejuvenate, almost like resuscitate like your own cells. And I've seen, even in just the 6 weeks I've been here, Didi, I've seen incredible
You
results.
told me the one guy came in for his knee, and 48 hours later he was fine.
Yeah, I mean we got people coming in literally like on a walker, like they can't weight bear, and they get the stem cell treatment, and they walk out. It's
Wow.
like things that you would consider like miraculous. But these are the kinds of results that they're getting. Well, I think there's definitely a tide, Didi, toward regenerative medicine. After the COVID fraud scam, a lot of people, intelligent people, professional people, really had to rethink organized medicine
Right.
and its role in their life as far as managing health. And a lot of people have given up. They're like, I can't trust the doctor anymore. Like
Right.
I just can't trust.
Right.
Like he pushed the vaccine on me. My friends and family had complications and myocarditis. I've seen some people die, and they're like, when you breach that degree of trust,
Yeah.
and you call something safe and effective, and you push it and you mandate it, you're going to have consequences, and we're seeing the consequences now.
Well, thank you very much. It has been an absolute
It's
pleasure.
a pleasure. This is one of the nicest interviews I've ever done. We're seeing the beautiful
Right?
Puerto Vallarta sunset coming down,
Yes.
and the weather is gorgeous.
We're
And,
sipping on our
cheers.
mango smoothies.
And
Cheers.
it is hard to believe that it's January. I think it was January 21st today.
Something like that.
That friends are sending pictures from Canada of snow
Minus
and
25.
So, I mean,
Celsius.
I'm going to say this with as much sincerity as I can muster.
Me too.
Our condolences about the weather,
Yeah.
and my
some severe.
condolences.